My patients call me Dr. V. And on the second visit, we offer our patient a free acrylic massager. And I wanted you to tell them, turn your face this way. I wanted you to tell the audience how this feels.
It feels pretty good.
Here we go. And I'm just going to do a little rub-a-dub-dub today. This is where the Ooohs and Ahhs come in, and the care plan, because it feels darn good. All of us have chronic, you could feel it, right? You could drop your arms off the side if you feel like it, that's good. All of us have chronic stress right here, and I'm going to relieve some of that stress and get in over the knots. Here we go. You could turn your face out. Unlike myself, you got some nice curly hair and some nice war paint today. Here we go. We'll get you feeling strong. Here we go. So you can have a full and healthy life. You can feel it right in here, right?
Yeah.
Most of us are knotted up here, and the computer contributes to that kind of stress. So I'm going to get right in here where most of us, am I going too hard?
No, that's good.
It's good? It's kind of bittersweet?
Yeah.
Yeah. We've all got some knots in there just from chronic stress, just from living life. It gets to us and those muscles tighten up, so I'm releasing some of those old tensions, some of those old hurts, and utilizing an acrylic massager. Here we go, here we go, here we go, here we go. Here we go, here we go. And we got them down here too. We have them in our backs, some knots from muscles being tight for years, not just days, not just one single event, but due to chronic stress. And tell me, Carol, is this or this tender?
Yeah.
Which one?
This one.
This one. Let's go here. Here we go. Here we go. Here we go. Right in there. Two. This one. Two. Right in here. So I'm getting around the pelvic joints. They call this the sacroiliac joint. There's an ilium here. There's a sacrum here. And that's how we get along. We can walk because of movement in these joints. And I'm lining up a sacroiliac, and many of us, about 80%, suffer from chronic lower back pain. And there's a complex and smooth movement that occurs here when the spine's working properly. And I'm working to create balance here because most of us suffer from lower back pain. And you're young, you're 18, right, Carol? Mm-hmm. And you had back pain. Mm-hmm. So it's quite common, even in people very young, they suffer lower back pain. Most people don't recognize it, but you could have back pain at 6, at 7, right? Here we go. And they call it growing pains. I want the audience to know there's no such thing as growing pains. That's nonsense. There is no growing pain. Most of those kids are subluxated. They have bones that are crooked, affecting their nervous system. And I'm going to use a special technique to line up her sacrum or her tailbone. I'm using a different instrument to do that. And I'm going to use a smaller instrument to work on the muscles on the sides of the spine. And I'm going to work on her hips today and make sure her hips are moving in and out correctly, and they are. And she's nice and supple, and I'm feeling with my hands to make sure there's no knots in the muscles of the legs. And I'm working with my hands here and checking the musculature. She doesn't have knots. It's not normal to have knots in your muscles. Head in the center, but most of us do, and it's due primarily to chronic stress, and it can be due to diet, and it can be due to lifestyle, just sitting at the computer terminal or looking into your cell phone creates tension here. So I'm going to work with my hands a little bit and stretch Carol out. And how's that feel, Carol?
Looks good.
Yeah, she just grew like 6 inches. No, that's not true. Here we go. We will relieve the tension in the muscles of the neck and shoulder region. And we'll do some advanced tests. And I'm going to push on her neck. And it should be resilient. It should move easily. It should be very flexible. As we mature, we get less flexible. These tiny impulses maintain the joints of the spine. And over time, people can regenerate. If the spine's left out of alignment, it tends to degenerate. And I'm going to line up Carol so that she keeps doing better and better, because she's doing great. And I'm noticing here that she's got good movement left to right. And I'm noticing just a little bit of lack of resiliency in the neck, in the joints of the neck. Here we go. And I'm going to work in using tiny impulses, gently realign, rehabilitate, and restructure her spine. Most of us have chronic tension right here in the shoulders. And I'm getting, you feel it right there, right? She's got a big old knot in her shoulder, and we're getting rid of that with the instrument. We're providing impulses, and that'll bring circulation, new blood, new fluids into the local tissues, and the tissues will recreate themselves with new healthy cells. The old and sick and dying cells will be replaced with new healthy ones, and she become healthier and stronger. And you can really feel that, right?
Yeah,
that is
good.
Just, turn your face to the right. They're wondering how this feels. What would you tell someone who's wondering how it feels?
It feels good.
It feels good,
Yeah.
right? Well, you know I'm hitting the right spots, right?
Yeah,
You
exactly.
can feel it there, right? Even though she's 18, she's still accumulated an extraordinary amount of stress, and the muscles are still tight just from dealing with the world, dealing with change, dealing with adapting to the constant change that's modern life, right? And it's going faster and faster. I'll help you adapt. Here we go. So I'm feeling with my hands that she's got some vertebrae or backbones that are crooked, and I'm lining up the backbones to help her stand tall, to give her dynamic posture. Because people judge us by how we stand, by how we move. They make assumptions. Here we go. So we'll give her proper alignment so she stands straight, feels good, looks good, moves easy. Here we go. Right here. Adjustments here help the heart and lungs, for example. Help us stand tall. Here we go. Adjustments here help the immune system, help fight viruses and bacteria. Adjustments here help the liver, help the adrenal glands. Is there anything else you'd like examined in particular today?
No, thank you.
Hey, share if you care, like, comment, subscribe, and I'll be back with something powerful and positive for you and yours.